My name is Brandy Walker, and right now I currently work for the Federation of Families of Florida. My diagnosis is schizoaffective disorder. I got involved with Suncaost. It was after my 7th Baker Act, and I wasn't doing any driving or anything at the time, and so it was easier to have a therapist come to my home. I was just in the bed, I was heavily medicated. My children, they were really young at the time. My boyfriend at the time, he's now my husband, did not really know how to handle my illness. And so my therapist was able to come in and work with our entire family unit. But right now, I work a lot with teens that have some pretty severe diagnoses. Anything that can help the families stay together. One thing that we focus on is letting them know that there's other parents that are dealing with the same thing that you're dealing with, and we're willing to assist and help you with that.
Hi, I'm Linda Leffler, and I am Medical Director at Suncaost Center. I realized that I just absolutely loved psychiatry. It was interesting and fascinating and rewarding, and I have felt that ever since. Since then, there have been a few situations that are usually related to some social function, and I've had either significant anticipatory anxiety that really caused me a lot of grief, essentially, before I went to those things, and then I either had to go to them, or if I decided I was not going to go, the anxiety really went away. I really believe that psychiatric illness is just as biological as any medical illness. So it's very analogous to having diabetes or high blood pressure. So I exercise regularly. I have gradually improved my diet. I think I have good stress management skills myself. I have supportive people. So I think all of those probably helped me, along with learning more about the disorder and what may have been underlying it in me in particular.
My name is Kerry. I have mental issues, PTSD, and in Vietnam, I couldn't handle it. I became overwhelmed, and the racism that was real for me. When I got out of the Marine Corps, I tried to live life in society as a normal person, but I couldn't because of my nightmares. I would go and I would steal. I would commit petty crimes, that I would go to jail because I felt safe. I really feel good about my success with Suncaost, because it seems like Suncaost understand. They had compassion for the bad things, the bad thoughts that I couldn't share with anyone else. I was able to share with Miss Kathy McCoy, which is my therapist.
My name is Bridget. I come from a little Mennonite village in Pennsylvania where mental illness is not addressed, and that's probably, why my brother and sister ended up committing suicide, because they were untreated and they were mentally ill too. They suffer like I do. When I moved to Florida, I was involved in a horrific scam where I bought a trailer, a really beautiful trailer, on a nice trailer park. And then they closed the park, and 17 people ended up committing suicide in my park. At that point, I had lost everything, and I ended up going to jail for 6 months because I had nowhere else to go, and I was really hopeless. And although expressive therapy is teaching me how to release these things, in a positive way, how to exercise, how to laugh, how to have fun with a group, just do normal social things that everyday people take for granted. But I find that showing up for life is 85% of it, like they say. So sometimes I just show up and just let it ride, like today, hoping for the best and just saying, I have these problems, but it's not who I am. Suncaost took me from a 2 to a 9.5. I don't let my mental illness define me.
My full name is Pearl Nanette Bowden. I was born in Brooklyn, New York. My mom was 15 when she had me, and my dad was 17. My dad was in a gang, so I grew up in that kind of lifestyle. I wasn't a normal young person. I was molested very young. You know, adults are supposed to protect you, but it didn't turn out to be that way. I went into to a gang lifestyle at the age 15. After a while, I got pregnant. So when I went to tell him, it was totally opposite of what I thought it was. And he got very upset with me. So on my way out of the door, he grabbed me and threw me on the bed and he raped me. So, due to the trauma of the rape, I lost my son. It was a little boy. I was already 5 months. I've been dealing with this on my own for all these years. And I don't want any other woman, young person, to ever live in that loneliness. I did a spoken word piece with a ministry called None Lost Movement. And they asked me, did I want to be a part of their conference called Safety. My piece was called Because I Said No. And she just loved it. And then she said that there was a woman that was going to be here representing the Suncaost rape crisis, and I didn't even know they had it over here. And then I met the lovely Noelle over here, and I gave my piece, and then we hooked up from there.
My name is Julie. I work for Suncaost Center. I'm a licensed mental health counselor, and I'm a therapist with the Parent Aid program, which is part of Total Family Strategy. Most of what my job has entailed recently has been classes and trainings and presentations and support groups, and how to work with families where trauma has been a piece of the puzzle. In typically what I'm finding is the parents grew up with trauma, the kids are growing up with trauma. How can we break that cycle? And a lot of times I have a sense, or I know, sometimes I know, especially in the parenting classes, that there are a lot of sexual abuse survivors in the room. And when I know that, I'll usually disclose really early on that I'm a sexual abuse survivor, and that I see the training and surviving that experience from both the side of having experienced it and from the side of trying to prevent it. I really see like a unified effort throughout the county of all of us working together to keep trying to make kids safer and families safer.
My name is Brian Sermon Sr.
My name is Jacqueline Bloom. Brian was born at All Children's Hospital in St. Pete, April the 10th, 2013. They thought that they could fix his heart, but he had to be placed on a list for a heart transplant.
6 months after the transplant, 9 months altogether after being born, he was finally released from the hospital. There was an incident a year ago. The best thing for him was to go into medical foster care. Medical foster care helped us get organized. I mean, it wasn't easy, but we made it through it for Brian. Everyone done stupid stuff when they was kids and teenagers. Well, some of the stuff I did, that's on my record now. Medical foster care, along with Eckert, they're helping us to complete these tasks that we have to do. The most important thing is getting Brian back home. Hopefully, I just keep my head up and stay positive, and I'll get one so we can get him home.
I am Linda Lerner, a longtime school board member and member of the board of directors of Suncaost Center. I am here to talk about my mental illness, which I had in the 1980s, depression, and I'm here to help break down the stigma. Depression is a treatable disease, and so many people do not get treatment because they are ashamed, they think it's a character flaw, they think they will be judged. And I'm here to say those of us who have had mental illness and successfully treated need to come out of the closet and give the encouragement to others who need it. we can be part of the solution. So I'm here to say, let's talk about it and let's be sure people get the help they need. And Suncaost Center is a very good place to get that help.
Be the end.
Be the end.
Be the end.